From the plains to the rolling hills, Oklahoma is a state that resonates with stories of resilience, determination, and pride. Welcome to Inside the 1581, a podcast of the Oklahoma Hospital Association. Together, we'll dive deep into the heartbeat of the great state of Oklahoma as we journey through the rich history, diverse culture, and the ever-evolving landscape within the 1,581 miles of border in our nation's 20th largest state. Each episode of Inside the 1581 will feature conversations with the many voices which help shape our state's future and our shared vision of improving health and healthcare in Oklahoma.
Thank you for joining us today for another edition of Inside the 1581. I'm Rich Rasmussen. I'm the CEO and president of the Oklahoma Hospital Association, and I'm your host for Inside the 1581. So today we're diving into a really important subject. We're going to talk a little bit about measles, and certainly the most recent measles outbreak and the role of vaccinations play in protecting our children and our communities. And so I am delighted here to be joined by some of our own experts here in Oklahoma. And joining me today is Dr. Stephanie DeLeon, who is the Associate Chief Medical Officer for Children's Services at OU Health and the Section Chief for Pediatric Hospital Medicine at OU Health. Stephanie, thanks for being here. And she is joined by Dr. Donna Tyungu, I got it right, Donna, right? Who is a Pediatric Infectious Disease Physician at Oklahoma Children's Hospital and a Pediatric Disease Section Chief at OU College of Medicine. Thank you guys for being here today. We really appreciate it. And we're going to talk about measles. And I thought before we get into it, maybe we just talk a little bit about yourselves, and then we'll get into some measles. So if we want to start with this, Stephanie, tell us a little bit about yourself, you know, what you've been doing for kiddos your entire career, why this is important and a passion for you. And then certainly, Donna, we'll switch to you. So, Steph.
So in my clinical life, I'm a pediatric hospitalist, which means I take care of kids who are admitted to the hospital. So I don't have a clinic or what you might typically think of. And I'm very passionate about the care that we provide at Oklahoma Children's for our pediatric patients.
Okay.
I, in my chief medical officer role there over Children's Services, really focus on the quality of care and the safety of care that we provide at Children's. And so that's what my life's about.
And so how many kids do you think you've treated in your career?
Oh, hundreds.
Hundreds of
I've been doing this for a minute.
Of healthy kiddos. That's what we want.
That they're healthy when they walk out our doors.
Well, that is important. Donna, tell us about yourself.
Yeah. Thanks for having us.
We're glad you're here.
Donna Tyungu. I am a pediatric infectious diseases specialist. When I was younger, growing up, I thought I was going to be a hemoc specialist, but then I decided that I really love everything parasites, everything viruses, everything bacteria, and everything
the stuff we played
fungi.
in the sandbox and everything. You remember you take your hands, you like to have stuff grow through your fingers.
That is, in fact, what she loves.
There you go.
Absolutely. That fills my cup up. I always tell people, frogs and Jesus fill up my cup.
I'm cutting you off, no, but my daughter wanted to be a paleontologist.
Okay.
And so she wore this hat that says, I dig dirt. And for the longest time, probably until she got into high school, paleontologist. Now she's a licensed clinical social worker. But you know, there's something about kids, mm-hmm. right? And unfortunately, we can't always protect our kids. There's some things that are invisible out there, right, that mm-hmm. do create risk for our children. And so thankfully we have folks like yourselves that are there helping to stand in the gap for our kids. And so I want to say thank you for that. Before we go on, explain to our listeners, if they don't understand, what an infectious disease physician does. Because this is probably like a new TV show on Netflix, something like that. It's probably out there.
There's
it would be a good
lots of TV shows on Netflix about what I do.
But okay, so you got to give us one. We'll put it on our Netflix list for our listeners too. Yeah.
What's that new fungus show that everybody's into?
I don't know.
We Walk With Us or something
I have
like
no
that.
idea.
Anyway, the fungus is taking over the whole world, and it's kind of like all of your listeners are going to be screaming it in their cars.
Fungus. Right? Yeah, I put that right there with my favorite show, which is Resident Alien. So if you have a chance, watch that one. That's on Hulu. All right, but go ahead.
Yeah.
Infectious.
So Stephanie or her colleagues will give us a call if there are infections that she can't deal with. So we see a lot of meningitis, a lot of encephalitis, a lot of complicated pneumonias. we just had a kid come in from Mexico who has an eye infection that they can't figure out. So anything infectious that people can't figure out on their own, they call us.
Very good. And I would assume that without your help, that obviously these infections cross over into a place where it's, the risk of mortality it grows much, much more, it creates greater risk.
I think it would create greater risk and also create greater antimicrobial resistance, because when we come on, we try to help narrow coverage for things based on what's going on with the patient.
Very good. So, let's talk measles now. All right. So I was doing a little research, talking to Google, but I think now everyone says we have to talk to chat. But I was using Google, and I was just curious, how many folks annually die from measles? And I was shocked to learn about 3 million people worldwide. That is, in this day and age, it's still shocking to me, a number like that. And I looked at the numbers of deaths that the United States had. And there was this huge plateau, and then it dropped off. Mm-hmm. And it dropped off around the time I was born, 1964. Mm-hmm. And something miraculous came into play as it relates to measles. Talk to us about that vaccine, how important that was.
Yeah, great. So you're absolutely right. There used to be 200 in the United States. There used to be 200,000 to 600,000 measles cases every year. So we used to have tons and tons of disease and death from measles. But 1962, 1963 is when that vaccine came around.
First vaccine, yeah.
Yeah, and it plummeted. It was kind of incredible. It plummeted the cases of measles. Then we've had a few little blips here and there, but we've never, ever gone back to that level of pre-measles before the vaccine. And hopefully we never do get there. But yeah, unfortunately, wherever there are low amounts of vaccine uptake around the world, you still see a lot of measles disease and death.
So we're talking measles, but let's step back here and talk about other diseases that are out there that this miracles of vaccines have helped us with. So my grandmother died of tuberculosis, before I was born, before any of my siblings were born. My mom was just a young girl, 9 years old. Her mom was taken away from her and died from tuberculosis in Chicago. And so you think about that today and where we are in our ability to push back on a very infectious disease too. Polio. A lot of us, at least in my age, I knew a lot of folks that had their parents or grandparents had polio. I even had a couple friends that had some results of polio before the vaccine was readily available. When I lived in Montana, Chaudere Children's Hospital was a polio hospital for many, many years in the early 1900s. And I think it was a polio hospital up until the 1940s. So we think about polio and certainly smallpox. So there, I think for young people today and perhaps young parents don't have a full appreciation of how different the world was in the early 20th century and the diseases that ravaged humans up until the time that we were able to develop effective vaccines to be able to protect ourselves, yes, but our children and our grandchildren. So when you think about vaccines, in your perspective, what has been so powerful about their use over the years that gives you great pause when you see that there's this tends to be still some vaccine hesitancy, not necessarily in the United States, but even in the world?
Yeah, I can start, Stephanie, and you can jump in. But I will say, like the word you used earlier and the way you're describing vaccine preventable illness is miraculous.
Absolutely.
Yeah. So you said miraculous, and that's the way I think of it. And even when I started my training, I was under the impression that all of these things were taken care of. Yeah. We wouldn't have to actually be treating them in this day and age, but they are miraculous, and they're readily available. They're super safe, and it is unfortunate that our historical that our minds now, we're so it's very TikTok-y, and it's very what's happening nowadays, but I feel like it's hard for people to think or slow down to remember historically where we were. And I think that's a big part of our problem nowadays.
Because we have grown up, everyone in this room has grown up without the threat of these diseases.
Exactly.
We don't worry about our kids or our nieces or nephews contracting some of these horrific diseases because for the most part, we've been able to suppress it with the herd immunities that we've created with more widely available vaccines. Am I correct? And maybe you guys can help me with this. We started vaccinating for smallpox when George Washington was president back during the Civil War. Are you guys familiar with that?
I don't know the answer.
I would have to look. I would have to investigate that further.
Anyone who's listening can quickly send it to us through Spotify or Apple Podcasts or YouTube about that. But I think there was, and maybe when we take our break, we'll go ahead and quick check on that. But I think I had read that that's one of the very first applications of a vaccine were used by taking some live cultures of smallpox and literally lancing or cutting the soldiers and introducing it to them.
No, absolutely. That part is correct. I just don't know about if the first president was involved.
Okay. I think I read it, that George Washington used that. So, that is correct in how we did that. So, very interesting. So if we talk about this, Stephanie, being the chief medical officer for children's services at OU, I would assume that one of the challenges that you've had with parents today is I think we talk about the TikTok world that we have, you having really good, clear information that parents can act on. Mm-hmm. And there's probably no clearer information with as many lives that have been saved than the efficacy of these vaccines. So talk to us a little bit about how you approach moms and dads about the importance of vaccinating their kids, because, what we'll be talking about here is really the MMR and MMR. We had the last one. What is it? MMRT? MMRV. Mm-hmm. Okay. So how do you approach that when you talk to parents?
Yeah, I think that's a great question. And it's one that pediatricians face every day when we're interacting with families. I think starting from a place of realizing that every parent is trying to make the best decision that they can for their child. I don't think any parent is intentionally wanting to harm their children, make bad decisions for their kids. But I think there's an incredible amount of information out there that is really free for anyone and everyone to access. Some of it's good information based in scientific fact. Some of it is legitimate and vetted, and some of it is not. And it can be really difficult sometimes for families to sort through what's real and true versus what is an opinion that's not founded in fact. And so I think it's really critical for pediatricians, for family physicians, to make sure that we're sitting down with our families and talking through what is real, what the risks are, what the benefits are, and to hear what families' concerns are about vaccines. I don't want to just push an agenda. I want to really create a partnership with families when we're talking about decisions that affect their kids. But vaccines are absolutely one of the most effective things that we can do to keep kids healthy. And so it's something that we want to talk about. We want to make sure families have good information when they're making decisions.
I can remember when my daughter, I have 5 kids, and I can remember my daughter looking at my shoulder and saying, "Daddy, what is that boo-boo?" And it was, I can't remember, was it the TB shot, the one that create the unique mark on your shoulder? What is, okay, yeah. I still have it, right? And so I think you can almost look at someone's age based on the shot marking that you have after that. But never thought anything about it. My parents didn't, but my parents grew up having had family members who lost their lives or were impacted by this. And for some of these diseases, obviously, some of the, not the symptoms, but the results of the disease, like we see, the measles outbreak, the lesions and things like that. Walk us through, so as we're talking about measles today, walk us through what are some of those symptoms or some of the effects, if you are unvaccinated, that you might experience as a result of being coming into contact with measles and actually being infected by it.
Yeah, I think most of these vaccine preventable diseases, measles especially, is where we are now is a product of our own success. Because you're right, people don't see these diseases anymore. They don't see the effects that they can have. And so I do think it's important for us to talk about those. Donna, I'll start and then you kind of fill in. So measles, when it first starts, may not look all that different than any other sort of common cold virus that kids may have. It usually does cause some pretty high fevers. It's not uncommon to get up to 104 degrees. There may be some watery, runny eyes that turn red, some congestion, a little bit of a cough. And then what really starts to set it apart is the rash that will develop.
Okay.
It starts on the head and then falls down to the rest of the body and is a really impressive rash that we actually call it a mobiliform rash or a measles-like rash that we actually will use as that description because it's so distinct. These kids are incredibly fussy or irritable. They are ill-appearing. They don't want to eat or drink. They're kids that are pretty sick, and that also sets them apart from maybe just a common cold or common virus where kids have some fever and maybe some cold symptoms but are better relatively quickly.
And you'll hear some folks will say, well, just let them, naturally fight the disease, right? And so obviously there are risks for that. And so what are some of the risks? Going untreated, parents decide, no, we're gonna keep them at home. We're gonna let them just, go through what are the effects of this disease.
Yeah.
What are the real risks that you have for that?
So first of all, it's just a little bit on the mean side, because when you hear people talk in the textbooks about what measles look like, it's like very commonly the sickest kid in the room. Like to make a child go through that type of kind of agonizing pain, fever, and rash where your whole body just hurts for 10 days, that's just a little bit mean. But the actual risks of disease after having been exposed, if you're unvaccinated, 1 in 20 of those kids will have a pneumonia. And pneumonia is actually the most common cause of death with measles. 1 in 1,000 of those kids will actually have an encephalitis, which is kind of like an inflammation of the brain. Many of them will be hospitalized. And people don't realize we haven't seen a death of childhood measles in over 22 years until just this past year with this Texas outbreak. So obviously death is a risk factor now. We've had 2 or 3 deaths of measles since the Texas outbreak. There's a few interesting things that people don't know about. There's one phenomenon called immune amnesia, that if you become infected with measles, your entire repertoire of immunity before that infection, 70% of it is just wiped out.
Really?
Yeah, and you're basically starting from scratch, which is
you put that. I mean, then you're immediately at risk for everything. That
3 to 5 years following a measles infection, they're at risk for other pneumonias from other things that they should have been exposed to.
So this notion of you're going to have lifetime immunities as you come in contact with these diseases, that what many people lead you to believe, you're literally wiping out all of your immunities.
Oh, you'll have lifelong immunity to measles.
To measles, right? But everything else, right?
Exactly.
Yes.
Exactly.
Yeah.
And I think that is one of those phenomena a lot of people don't really understand or know about. So they're breastfeeding their babies and they're doing all of these amazing things for their babies, but all of that immunity kind of gets washed out as well with a natural measles infection, which is really unfortunate. And then the other thing is measles in pregnancy can be very devastating for both mother and child.
And so tell us a little bit about how that can be devastating.
It can actually lead to stillbirth. It can lead to premature delivery.
And that's mom contracts measles,
right?
And that can lead to the stillbirth. Okay.
Right.
Can measles then be transmitted to the child in utero? Okay.
Yes. It's actually termed congenital measles, which no physician probably walking the planet right now has taken care of congenital measles, except for in Texas. I know they had a couple cases of congenital measles. So I just think the risk ratio has shifted a bit and that's what I would love for families to kind of consider, is like when we're in an environment where we have vaccine protection and vaccine immunity, that's one thing about deciding not to vaccinate your children. But when you're in an environment where where our rates are down to 88%, you're in a higher risk environment with a very pathogenic disease that not a lot of physicians walking on the planet have ever treated. I think the risk ratio
because we've
changed.
essentially eradicated
Right.
from it.
Right.
Interesting. So when we talk about, we were just talking about breastfeeding. So in that scenario, mom is doing everything she can to pass on immunities to help her baby so that she has the best or he has the best start. But yet, we don't have the ability to start vaccinating or provide a vaccination for a baby until how old?
So the youngest we would go is 6 months of
6
age.
months, okay. And then if it's a 2-shot regimen, that they don't finish that up until they're 4 years old? Is that how it works?
So classically, when we talk about vaccination, kids get their first shot, usually 12 to 15 months, and then their second shot at the age of 4. So when you're saying finish at 4, that's where that's coming from. In an area where you're having an epidemic or an outbreak of measles, or travel to an area where there's a higher risk of exposure, we can actually give that first shot at 6 months of age. And so that's what Donna was referencing a little bit earlier. And the second shot can actually be given younger than 4 years of age too. We just have to wait for a month after the first shot. But if we did have a baby that was given it at 6 months of age and given it early, we would wait till they were a little bit older to get that second shot.
And that first shot creates an immunity of about, 90%, 92%? 93%. And then the subsequent shot will take you up to, as I read it, 97%. Is that about what it is? So clearly, the evidence will show us that there is extreme efficacy for vaccinating. And so if you are someone that hadn't been vaccinated as a child and you're at risk, we're all at risk if you're unvaccinated, at any time you can pursue being vaccinated through your health department or through your primary care physician to be vaccinated if you have been unvaccinated as a child.
That is correct.
Or
Even
any pharmacy.
Or any pharmacy. Or any pharmacy. Yeah. Okay, that's very good for folks to know. And is it a 1-shot or is it would that be a 2-shot for an adult? How does that work?
Yeah, so that first dose is 93% effective.
Okay.
So I don't remember exactly for an adult if they would need that second dose.
Okay.
But if they needed that second dose, they could talk to their medical provider about that, but then they would need to wait at least 28 days to get that second dose.
Yeah, you got to remember you're talking to 2 pediatricians here.
Well, that's okay.
We are
That's
not,
okay.
Super up to date on adult.
You're helping babies get well from the start, right? Well, we're here on this edition or episode of Inside the 1581, and we're joined by Dr. Stephanie DeLeon. DeLeon. DeLeon.
You're good.
I'm wearing these Invisalign braces, so it's kind of hard to talk,
That's pretty impressive.
DeLeon. Associate Chief Medical Officer for Children's Services at OU Health and Section Chief of Pediatric Hospital Medicine at OU College of Medicine, and Dr. Donna Tyungu, who is the Pediatric Infectious Disease Physician at Oklahoma Children's Hospital and a Pediatric Disease Section Chief at OU College of Medicine. And we're talking about measles and all things vaccinations. And so when we come back to this edition of Inside the 1581, we're going to pick up our conversation about where we are in the measles outbreak nationally and the cases that we've seen in here. But before we return, we're going to listen to a quick message from our sponsors at PYA.
In today's healthcare environment, one size does not fit all. Resources are limited, but demands are not. PYA's Overwatch lets you choose the exact level of compliance support you need without paying for the services you don't. Your Overwatch is built for you. Learn more at pyapc.com.